Good morning, I'm Emma Visser and I'm in a group with Anissa Quintanilla and Sarah Miller, and we looked at emphysema. So an overview of emphysema. Emphysema is a lung condition that causes shortness of breath. In people with emphysema, the air sacs in the lungs, also known as alveoli, are damaged, and over time the inner walls of the air sacs weaken and rupture, which creates larger air spaces instead of lots of small ones, and this reduces the surface area in the lungs, and in turn the amount of oxygen that reaches your bloodstream. So when you inhale, the damaged alveoli don't work properly, and the old air becomes trapped, and which leaves no room for fresh, oxygen-rich air to enter your lungs. So for symptoms, you can have symptoms, or you can have emphysema for many years without actually recognizing the signs and symptoms. But the main symptom is shortness of breath, and that usually begins gradually. And you can also have persistent cough and chest pain. So you may start avoiding activities because they cause you to be short of breath. So the symptom doesn't actually become a problem until it actually starts to interfere with daily tasks. And emphysema eventually causes shortness of breath even while you're at rest. So for the causes, the main cause of emphysema is long-term exposure to airborne irritants. So that may include tobacco smoke, marijuana smoke, air pollution, chemical fumes, and dust. And rarely, emphysema is caused by an inherited deficiency of a protein that protects the elastic structures in the lungs. And on the picture to the left, you can see the left pair of lungs are healthy and the alveoli are healthy. However, on the right side, that's lungs that have emphysema from smoking, and you can see the alveoli are damaged. So in order to determine if you have emphysema, the doctor will normally ask you a list of your medical history and do a physical exam, and they may recommend a variety of tests such as imaging tests, lab tests, and lung function tests. So for imaging tests, that can include a chest x-ray, which can help diagnose advanced emphysema and also rule out other causes of shortness of breath. And then for lab tests, you can do a blood test, which can be taken from an artery in your wrist in order to determine how well your lungs transfer oxygen into and remove carbon dioxide from your bloodstream. And with the lung function test, these are just non-invasive tests that measure how much air your lungs can actually hold and how well the air flow how well the air flows in and out of your lungs. And they can also measure how well your lungs deliver oxygen to your bloodstream. So emphysema can't be cured, but treatments are definitely there to help relieve symptoms and slow the progression of the disease. So depending on the severity of your symptoms, the doctor may suggest certain medications such as bronchodilators, which can help relieve coughing, shortness of breath, and breathing problems by relaxing constricted airways. There's also antibiotics that can help if you have a bacterial infection like acute bronchitis or pneumonia. There are also different types of therapy that can help, such as pulmonary rehabilitation and nutrition therapy. So with pulmonary rehabilitation, that is a program that can teach you breathing exercises and techniques that may help reduce your breathlessness and improve your ability to exercise. And with nutrition therapy, that will provide advice about proper nutrition, and in the early stages of emphysema, many people need to lose weight, whereas people with late stage emphysema normally need to gain weight. And depending on the severity of your emphysema, the doctor may even suggest surgery, and in that case, they'll do a lung transplant. And lung transplantation is an option if you have severe lung damage and other options have failed. So prognosis, again, there is no cure, but many symptoms can be managed if treatment steps are taken. Even people whose emphysema is severe have a good chance of surviving for 5 years or more. And in people with emphysema who smoke, their expectancy can be reduced by 10 years or more due to how the smoking drastically affects the severity of the illness. And people with mild emphysema who quit smoking typically end up having a normal life expectancy. And those who adopt good, healthy habits can enjoy a fairly normal lifestyle. lifestyle for a long time. So for the PSA, first we can look at the risk factors. So factors that increase your risk of developing emphysema include smoking, your age, exposure to secondhand smoke, and exposure to indoor and outdoor pollution. So with smoking, emphysema is likely to develop in cigarette smokers. So the risk of all types of smokers increase with the number of years and amount of tobacco smoked. And for your age, although lung damage occurs in emphysema develops gradually, most people with tobacco-related emphysema begin to experience symptoms between the ages of 40 and 60. And with exposure to secondhand smoke is smoke that you inhale from someone else's cigarette, pipe, or cigar, which can be really bad for your lungs as well. And exposure to indoor and outdoor pollution, breathing indoor pollutants such as fumes from heating fuel, as well as outdoor pollutants like exhaust from a car, can increase your risk of emphysema. And for prevention, the most important things to prevent yourself against emphysema is to, one, not smoke, and two, avoid breathing secondhand smoke, and also wear a mask to protect your lungs if you work with chemical fumes or dust, just to protect yourself extra. So that is it, and here are my sources. Thank you.